Mrs. منى 40 years menorrhagia. يلا
40 years.
معاكي 13 دقيقة. معاكي 5 دقايق تجهيز. عند الدقيقة 7 هقول لك إن فاضل لك إن وقت الهيستوري خلص. عند فاضل دقيقتين هقول لك 2 minutes remain. start.
Hello, I'm Dr. Yasin, one of the doctors in the medicine clinic for today. May I confirm that you are Mrs. Mona and you are 40 years old?
Yes, doctor.
Mrs. Mona, today we are here to discuss about your health condition and I'll be happy to examine you and address your concern. Is it okay for you?
Yes, please.
It came to my knowledge that you have heavy bleeding. Can you tell me more about it?
Yes. I have 8 months now of heavy periods, doctor.
I'm very sorry to hear this, Mrs. Mona. It must be concerning for you. Is it the first time in your life to have such heavy bleeding?
Yeah.
And what do you mean exactly by heavy bleeding? Like the flow or the days, number of days?
Yes, I change many pads per day, more than usual.
Very sorry to hear this. Is there any chance that you're pregnant?
No.
Okay. And before, never happened to you before?
No.
Okay. Do you use any birth control pills?
No, I'm using intrauterine device.
Intrauterine device. Did you notice after you inserted this device, the things goes in this way?
No, it happened there now for I think 2 years, but this started 8 months ago.
Okay. Okay, I'm very sorry. With this, do you have any weight change?
No, my weight is okay.
Okay. Any tiredness, any fatigue?
Yes, I feel tired most of the day now. Yes.
Does anybody told you that you look pale than
Yes,
before?
many commented. Yes.
Do you have awareness of heartbeat?
Yes.
Sorry for this. You have chest pain as well?
Chest pain? No chest pain.
Breathing discomfort?
No.
Do you have any bleeding from any other body orifices?
I didn't recognize any. No.
Is there any dark coloration of your back passages?
No.
Any dark water work or urine?
No.
Do you have any skin changes?
No.
Okay. Mrs. Mona, may I ask you, before this happened, did you fall sick or you had any high body temperature?
No.
Okay. Any skin rashes?
No.
Loss of appetite?
My appetite is okay.
Any lumps and bumps in your body?
No.
Any weather preferences?
No.
Dizziness on standing position?
No. Yes, there is dizziness of standing position. Yes.
This is also since last 6 months?
Yes. 8 months, doctor.
Okay. 8 months. Okay. And do you have any alteration of your bowel habit?
Yes, my bowel is more hard hard motion most of the time.
This is since how long?
For a long time now.
Okay. Right. And do you have any headache?
Headache? No.
Vision problem?
No.
Any joint pain?
Yes, I have some knee pain.
This is since how long?
This has been there for now 5 years. I've been diagnosed with osteoarthritis, and I'm taking non-steroidals. I'm taking painkillers a lot.
Did you increase the frequency of painkillers?
As usual, but I can take it 3 to 4 times per week.
Okay, right. Okay. And do you have any other joint problem other than your knee?
No.
Okay. Do you feel tired or fatigued? You told me also.
Yes.
Okay. Okay, right. And do you have any mouth sores,
No.
private area sores?
No.
Is there any health condition I should be aware of it?
Yes, I have been diagnosed with hypothyroidism, underactive thyroid gland, and I'm taking the replacement for it.
Are you compliant to the medicine?
Yes,
Which medicine you are taking?
I'm taking thyroxine, doctor. I'm taking
How much is the dose?
100 microgram per day.
Do you follow the precaution like in term of taking it on empty stomach?
Yes, I'm trying my best. Yes.
Do you take other supplements with this like iron, magnesium,
No, no,
calcium?
no, no.
Do you eat balanced diet?
I'm trying my best. Yes.
Okay, is apart from hypothyroid any other problem?
No, the osteoarthritis problem. Other than this, no,
Okay, any allergy to medicine?
no,
Any other medication apart from Euthyrox?
no,
Very sorry to ask, any illicit drugs?
no,
Did you hospitalize before for any reason?
no,
Did you receive blood transfusion?
no,
Okay. And do you have any sharing needles or tattooing?
no.
Have any family history of similar condition?
Yes, doctor. My mother diagnosed with cancer womb, which she did a surgery for that.
Oh, I'm very sorry for this.
Okay.
Okay, is it any other health condition?
No, no.
And what do you do for living?
I'm housewife.
How is the things what's happening affecting you
Nothing.
in
Just
daily
I'm
activity?
feeling fatigue most of the time now. Many commented that I'm looking paler.
I'm very sorry. We have our occupational healthcare social worker who can help you in this regard. Do you
Okay.
drink alcohol?
No,
Do you smoke?
no.
Do you eat balanced diet?
I'll try my best. Yes.
Okay. May I examine you?
Yes, please.
I need vital signs of the patient.
Yes. The blood pressure is 110 over 90. The pulse is 100 beats per minute. Respiratory
Mm-hmm.
rate and temperature is okay. Anything else in the general examination, in the vitals you need to ask?
Blood pressure sitting and standing.
Yes. There is postural hypertension.
Okay. I need to see if the patient looks pale,
Yes, she is pale.
jaundice,
No,
any mouth sores.
no,
Okay, I need to examine the patient abdomen. Any palpable mass,
no palpable mass.
any tenderness,
No. Which organs you want to examine, doctor, specifically?
uterus,
You want to examine the uterus? Okay. There is no
mm-hmm.
palpable mass. Yes. Anything else?
Abdomen, spleen,
Spleen. Okay. No palpable spleen. How would you like to proceed?
lymph nodes,
Okay. No lymph node.
no lymph node. I need to examine the heart. Patient has tachycardia.
Yes, very good. What do you want to examine?
Pulse is regular.
Yes. Pulse is regular.
Is any murmur?
Yeah, no, murmur? No murmur.
No murmur. Okay. Hmm. I need to examine the thyroid of the patient.
Yes, very good. How would you like
Mhm.
to examine?
I will give a glass of water. I will ask her to swallow and
Okay.
see.
Okay.
Mhm.
No palpable.
And I will pump it. Okay.
Yes.
Miss
Yes.
Mona, may I ask what was the last time you checked your TSH thyroid test?
Yes, doctor. I checked my TSH about 3 months ago and it was 7.
Did you adjust the dose?
Yes, at that time, the doctor raised the dose from 50 micrograms to 100 micrograms.
And you're compliant to it
I try my best, yes.
on empty stomach every day?
Yes, yes.
Okay. Mm-hmm. Okay. Any nodules in the thyroid? Anything?
The palpation, no.
Hmm. Any retrosternal extension?
No.
May I ask you what's your concern?
Do you want to examine anything else? You still have 4 minutes.
In this patient, if there is any tremors, if there is any like proximal myopathy, knee
Yes,
joint,
yes,
if there is any tenderness in the
yes.
knee,
There is examination of hypothyroid state. What you want to examine?
okay. Okay, the pulse, the cold hand,
Yes.
the proximal myopathy,
Yes.
the hair loss,
Yes.
and to check for any goiter, to
Yes.
check for any delayed reflex,
Yes.
and
Anything else?
to examine the knee joint,
Yes.
any edema.
Yes. There is mild edema. Yes. You need to
Mm-hmm.
examine anything in the eye itself for the hypothyroid state.
In the eye.
Maybe some
Any
plasma.
yes, xanthelasma. Okay, تحبي انتي
Yes. And
xanthelasma
and
أوي.
and
Mhm.
outer third of the eyebrows.
Yes, yes.
Yeah. Yeah. Yes. Okay. All of these are negative. Do you want to examine anything else?
The knee joint.
Okay. There is some crepitus.
Okay. Um, may I ask you what's concern? تعبت
My
أوي دلوقتي
concern
تعبت جدا.
about this heavy periods, doctor. What could be the cause?
Okay. After I spoke to you and evaluating you, Mrs. Mona, I think it's still the things related to your thyroid. I think it's not controlled still, and because of this, you have heavy bleeding. The cause why till now it's not controlled, I'm not sure honestly, but we need to run some blood tests to confirm about if your thyroid is controlled or no, and we need to do blood test for this, and we will make a multidisciplinary team and we'll come back to you with the result. Do you have any other concern?
Yes. Could be any
Mhm.
other cause, doctor. Could be related to my mother's cancer, maybe.
Your concern is very valid. Yes, cancer needs to be ruled out in your condition since you have a mother, your mother had a cancer in her womb.
Okay.
Do you have
Okay,
any
doctor.
other concern?
No, you still have 1 minute if you want to add anything or examine anything.
No, thank you. I'm so
Okay.
tired.
Now discuss with the examiner. Present your positive finding, please, your diagnosis and differential diagnosis.
Mrs. Mona, 40 years old, who presented with heavy bleeding,
Okay.
on past history of hypothyroid, with she's taking 125 microgram. A last reading of TSH it was 7. She is saying that she's trying to do her best to be compliant to the medicine, and she's having family history of uterine cancer. On examination, she's having symptoms of anemia like palpitation, breathing discomfort, and she looks pale. On
Okay.
examination, she's pale, and I couldn't appreciate any thyroid goiter. I couldn't appreciate any hypothyroid state. واللي عندها hypothyroid state.
Continue.
And abdomen examinations is unremarkable, and cardiovascular examination is unremarkable.
Okay.
So,
So,
most likely she is a case of primary hypothyroid, which is still not controlled with medication. However, we need to rule out uterine cancer in her condition.
okay. Any other cause could present in the in similar condition?
Any other cause which can give menorrhagia, you mean?
Yes.
If the patient has any thrombocytopenia or immune thrombocytopenia, this might justify why she is having any blood disease,
Okay. Any
might
other
justify.
endocrinal cause?
Uh, uh, Apart from hypothyroid, I think there is no any other endocrinal cause which can give.
Yes. Could hyperprolactinemia result in the same picture?
Yes, it can give irregular bleeding, but it will give
Yes.
amenorrhea. But it will give amenorrhea more than menorrhagia.
Could give irregular bleeding, could give both pictures. Did you ask about the rest of the woman's symptoms, like the milky discharge? Did she have any previous pregnancies or difficulties in pregnancies?
Oh, I forgot totally.
Yes,
لا.
because PCOS,
Mhm.
because the hypothyroidism, the PCOS, and the prolactin disorders could result in similar causes. Okay, so
Mm.
other than ITB, any other maybe blood disorders you need to exclude?
Mm. Yes, yes. يعني woman symptoms we need to ask all.
Yes. Yes.
difficulty in
Continue,
pregnancy.
doctor. Continue. So, other than other blood causes you need to exclude.
Other blood causes, um, immune symptoms of cytopenic purpura. Maybe von Willebrand factor deficiency,
Very good.
maybe antithrombin 3 deficiency.
Okay, very good.
Also we need to rule it out.
Okay.
And
Okay, so you need to rule out the vascular cause. Yes. And you need to rule out maybe hereditary hemorrhagic telangiectasia
mhm,
and other vascular cause. You need to rule out platelet-related causes like ITB and von Willebrand disease. And you need to rule out the coagulation-related causes. Yes,
mhm,
like the liver cell failure, the kidney failure, maybe the patient using other drugs like warfarin or non-steroidal. Yes,
mhm,
yes.
mhm.
And the third part you need to rule out is the woman related causes. What woman related causes in this case you need to exclude?
Uterine fibroid,
Yes, local cause like uterine fibroid, like what else?
malignancy, polyp.
Malignancy. Yes, and what else?
Mm,
The intrauterine device. Did you ask the patient to you need to include the woman doctor? Maybe she need to revise the woman doctor regarding changing the method of contraception here.
آه،
Yes.
yes.
So you needed this in the.
الحالة دي مش
Okay.
لطيفة قوي
How
بصراحة،
would you like how would you like to investigate this patient?
apart from full blood count for anemia, I'm
Yes.
looking for platelet count for thrombocytopenia.
Yes.
And we need also to do TSH
Yes.
as well as free T4. We need to do serum prolactin.
Yes.
We need to do still pregnancy test for her.
Okay.
And we need to do ultrasound for her uterus ultrasound to see if there is any fibroid, if there is any malignancy. We might need also to do to involve the woman doctor to do DNC or curate for biopsy and to rule out malignancy. And we need to do chest X-ray of the knee.
This could be complication. It's not directly related to the menorrhagia. طيب,
Mm.
this case need a specific approach. You need to start with is it your first time, onset course duration, attacks, diurnal variation, any increase, any decrease. Then
Mhm.
with any bleeding, the next question, any other bleeding, and you
Mhm.
asked about any other
Mhm.
bleeding, any orificial bleeding. With this, do not forget to ask any blood transfusion, how she compensated with this bleeding. So you need to ask about
أيوة.
any blood
Mhm.
transfusion.
Mhm.
Followed by this, you need to ask any other drugs like painkillers or blood thinners, and you need to ask
Mhm.
about them by name. Okay,
Mhm.
ده الثلاثي بتاع البليدنج. Then you need to ask about the effect of bleeding. The red flag here in this patient is to exclude the anemic heart failure. So you need to ask about any shortness of breath awakening you from sleep, gasping for air, any leg swelling, any maybe increase the number of pillows. You need to ask specifically. The examiner need
Mhm.
to hear you asking specifically about the patient developing anemic heart failure. Then you need to ask
Mhm.
the woman symptoms, all the woman symptoms. Maybe oral contraceptive pills, maybe the previous pregnancies, previous miscarriages, about the periods, the timing, the number of pads, and do not forget to complete the woman with asking about breast. The woman have some woman association. What are the woman association? The breast discharge, specifically if you are suspecting prolactinoma, the intimate relationship, maybe if you are suspecting Sheehan, she will have problems with
Mhm.
the intimate relationships, and the acne and the hirsutism if you are suspecting PCOS. دول اسمهم ملحقات الومن، هم مش وومن بيرسي، ولكن هم 3 أسئلة بنكمل بيهم أسئلة الومن في حاجات معينة، فده مهم جدا. when you ask this خلاص.
Breast discharge, intimate relationship.
and yes and any acne or hirsutism. وصلتي هنا هتكملي جنرال، هتكملي عايزه تبداي بي دي اف، تمام، هنبدا بي دي اف، هنعرف انها هايبوثايرويد. ودايما بي دي اف زي ما بنسال في الدايابيتس واتس يور لاست هيموجلوبين اي 1 سي، انت ديلايد قوي تو اسك تي اس اتش، كان المفروض من الاول.
أنا نسيت أصلا، نسيت خالص يعني.
يس فخلاص
مم.
هايبوثايرويدزم، يعني هنسال على طول وات واز يور لاست تي اس اتش. الدراج هيستوري خلاص انت سالتي، بس كان المفروض ان هو يسمع منك مع البليدنج انه اسك فور بين كيلر اور بلاد ثينر، واسك اوف فاميلي اوف كانسر. الديفرنشال دايجنوزس واحد من
البين
ثلاثه.
كيلر هنا ممكن يعمل بليدنج؟
يس وات.
البين كيلر يعمل بليدنج
اه طبعا، اه
لأن
طبعا ان ستيت تعمل وارفرين او بلاد ثينر، يعمل ده او ده يعمل. تمام.
مم.
الديفرنشال دايجنوزس بتاع المينوراجيا واحد من ثلاثه، لا اما اندوكراين ريليتد، لا اما بلاد ريليتد، لا اما وومن ريليتد. اندوكراين ريليتد الهايبوثايرويدزم، الهايبر برولاكتينيميا، والبي سي او اس. اوكي.
مم.
البلاد ريليتد
مم.
عندنا البلاد ريليتد ده بنقسمه لا اما فاسكولار ريليتد، حاجه ريليتد تو الفاسكولار، واشهرهم الهيريديتري هيموراجيك لاندكتيزيا والاهرال دانلوس والفاسكولايتس بانواعها زي نقص بيربورا، اي حاجه بتعمل بيربورا. بليتد ريليتد عندنا ريتد ديكريز ان كاونت زي الاي تي بي، او حاجه فيها ديستركشن مثلا
مم.
زي البي ان اتش او التي تي بي او الاتش يو اس، المهم بليتلت ديكريز ان نمبر، اور بليتلت ديكريز ان كاونت زي الفومبل براند. وكواجيليشن
مم.
ريليتد، كواجيليشن ريليتد اشهرهم الهيموفيليا
مم.
والديسفايبروجينيميا، بس الهيموفيليا باي نيم، والاكوايرد بقى في حالات الليفر سيل فيلير والرينال فيلير والدي اي سي والدراج انديوز زي الورفرين. فهو البليدنج ثلاث حاجات، لا فاسكولار لا بليتلت لا كواجيليشن. والثالثه العمود الثالث بتاع المينوراجيا الومن ريليتد، اشهر حاجه الكانسر، فايبرويد اند انترايوتراين ديفايس. في رد الكونسيرن هنا كان المفروض ان انت تكلمي معاها ان هي she need to revise her woman doctor, maybe she need to change the method of birth control بتاعها, maybe she need
مم.
to screen for cancer because the patient is 40 years and has mother في إجابة الكونسيرن. الاكزامينيشن بتاعك طبعا اكزامينيشن بتاعك جنرال اكسكلود البالور والجوندس. بعد كده هنمسك الثلاثه دول نراجعهم. اول حاجه البليدنج ريليتد هيهمك قوي الليمف نود والبلبابل ليفر اند سبلين مهم جدا. انت اسكد يور فور اني اذر راش، لو في اذر راشز فشو مي في ساعتها لو في اني اذر راش. بعدين الحاله بقى عندك فيها هايبوثايروديزم، فطبعا بلبيت الهايبوثايروديزم هو عباره عن بلبيشن للثايرويد. بنبص للفيس، بنبص للزنتلازما واللوس اوف اوتر ثيرد اوف اي براوز والهير لوس. بعدين طبعا البلس والبروكسيمال مايوباثي، وبننزل على اللور لمب عشان الديليد انكل ريفلكس، ولو في لور لمب اديما او اي راش موجود في اللور لمب. وفي الاخر احط السماعه على التشست عشان اسمع انيميك هارت فيلير، وشكرا على كده. التريتمنت اوف ذا كوز هي حاله for differential diagnosis, so you need to control the thyroid status, you need to revise the woman doctor and so on. نفس الحالة دي تيجي اي تي بي، نفس الحالة دي على فكرة البرولاكتين بيعمل كده وبيعمل كده. تمام. عشان بس المعلومة دي، بس خلاص خلصت الحالة.
مم.
تمام، هي الفكرة
انت
بس
قلتي الثلاث
الدخلة.
أسئلة بتوع البليدنج.
البليدنج
البليد.
اول قالت لك bleeding is it your first time any other bleeding orifice وتعدد لها زي ما انت عملتي في urine, any change any bleeding from your water work, any darkness of your back passage, any rash in your skin, any bleeding from your nose,
مم.
coughing up blood,
أيوه.
vomiting up blood، اللي هي الاذر bleeding orifice
واسأل على
وتعدديها. وبعدين
واسأل على ملحقات الومن.
هي بصي،
الديscharge، الانتيميت
هنا في
ريليشن
اتنين
شيب.
هنا في اتنين بندلز هنا. بندل البليدنج اللي هو any other bleeding, any blood transfusion اختها على طول بعدها any drugs زي بين كيلر او بلاد ثينر، هم عاملين نغمه اهو بين كيلر اور بلاد ثينر. ده البندل الاولاني بتاع بندل البليدنج. بندل البليدنج خلاص لو في بندل البليدنج ده بوزيتيف هيوجهك في سكه البلاد، في سكه البلاد. فسكه البلاد اخواتها مين بقى؟ اخواتها بقى اللي هو السبلينوميجالي بقى والقصص دي لمس وربمس، ولو في هي بون مارو سبريشن او المهم ده لو قصه البليدنج بوزيتيف معايا. والبليدنج اخوه الريد فلاج بتاع البليدنج مين؟ ريد فلاج البليدنج الهارت فيلير. فاسال باي نيم تشيست بين اسئله عشان اكسكلود الهارت فيلير. واسال لو البليدنج بوزيتيف فاخواته مين اللي هم البون مارو، اخواته البون مارو اللي هو زي الانفكشن.
مم.
الانفكشن وفيلينج والانيميا اللي هو الفيلينج بين. المهم يعني البليدنج يتسال على بعضه. لقيت ان هو خلاص اني اذر اوريفيسز قالت نو 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 نو، فبكمل الومن كله باخواته.
مم.
باخواته لما تكوني مش عارفه
مم.
الحاله محتاجه ان انا اسال بريست تشارج او لا، خلاص اساله احتياطي، لان انت خلصتي بدري فكان ممكن ان احنا اصلا انا خلصت البليدنج خلصت الومن، انا باقي الهيستوري بتاعي البي دي اف والاس دبليو ساد وبقيه القصه كلها
مم.
تحصيل حاصل.
مم.
خلاص. ودي من الحالات اللي بخش فيها في الامتحان وكاتبه في ورقه الاكزامينيشن على جنب الديفرنشال دايجنوز بتاعي. المينوراجيا واحده من ثلاثه، لا اندوكراين لا بلاد لا وومن. والاندوكراين هايبوثايرويد
مم.
هايبربلاكتيميا، يعني انا كان يعني دماغي يعني المفروض ما تطلعش من واحده من الثلاث اسباب دول، وغالبا يو نيد تو اكسكلود مالتي فاكتوريال يعني. اوكي.
مم.
بس
اوكي.
بس هي ترتيب بس غدة
تمام يا دكتور.
البليدنج نظبطها عشان تبقى مع بعضها، والومن برضو تتقال مع بعضها.